Are you worried about how long your joint replacement implant will last? You're thinking of a knee, hip or a shoulder replacement surgery, and what's bothering you is, I've read it doesn't last long. Is that what's bothering you? Hi, I'm Dr. Vikram Mhaskar, a knee and shoulder surgeon from New Delhi, India, and welcome to yet another video. And in this video, we're going to be talking about what's the truth about how long joint replacement implants last. So first things first, let us understand what are replacement implants. So joint replacement can be of any part of the body, may it be the shoulder, hip, knee, etc. I'll focus on the knee and shoulder, which are my areas of expertise. So these are the joint replacements typically that you see in the knee and shoulder. So this is a total knee implant, this is a reverse shoulder implant, and this is a partial knee implant. So remember, joints are made of bone and cartilage. So they are where 2 or 3 bones meet. So where they meet, there can be movement. And where there can be movement, the surfaces should be smooth. So you have cartilage on those areas. So when cartilage finishes or gets over, you need something to substitute the cartilage. And what you put over it is a cap made of various materials which are very smooth so that there's no friction. This is joint replacement surgery. And what are these caps made of? These caps are typically made of 2 main substances. The latest and best is Cobalt Chrome. It's a highly polished surface, something like a very good quality stainless steel, but much stronger and better. That's the latest. The slightly older generation was titanium implants. These are the main 2 which are used. They may have gold coating, carbon coating, etc. But they're mainly, the substance is made of this. They are highly polished surfaces so that friction doesn't happen. Now between these, sometimes we apply plastic spacers to substitute for cartilage like the meniscus, etc. in the knee. These are made of high density polyethylene. Sometimes they have vitamin E in them to make them last longer. So this is what joint replacement implants are made of. So typically, these are not really replacements, but they're resurfacings. Resurfacing meaning, for example, if your wall is there and the paint has gone off, what do? You call your painter. The painter takes a sandpaper, rubs the wall. So when he rubs the wall, it becomes smooth and then he paints over it. Same thing is done here. You don't really break the wall and put in a new wall and then paint it. You smoothen the wall and then paint it. So here, unfortunately, you're born on earth with just 1 bucket of paint. When it's over, the only thing we have is wallpaper. And that wallpaper is the cap that we put into your knee, shoulder. This cap can be on the whole surface when we call it a total joint replacement, total knee replacement, total joint arthroplasty, total knee arthroplasty or shoulder arthroplasty. When it's only one area, let's say the inner or outer or kneecap, then we call it a partial knee replacement, arthroplasty, whatever you may call it. In the shoulder, there are 2 types. One is an anatomical shoulder, wherein a cap is put on the ball and a cap is put on the socket. And now the latest is reverse shoulder. So this is a true replacement where you put a ball into the socket and you put a socket into the ball. The advantage of this is it's not dependent on something called your rotator cuff, which when you get older may not work properly and gives you very quick recovery. Now, when you put in these structures, how do you fix them? You fix them with something called cement. Now this cement is typically like the cement you use to build houses, but it's slightly more sophisticated and does not react with the body. It also has some antibiotic in it to minimize chances of infection. So it's fixed with this. And it is strong the moment you put it onto the joint on the table and it sets in. So there's no drama in joint replacement surgery that don't put weight, don't do this, don't do that. No, you can put weight immediately because it's already set and in place. Now how long it lasts depends on how you maintain it. And there are a couple of things here. First, starting with the surgical expertise. So if it's the knee, remember weight should be going through both ends more or less equally. So when it's going on both ends more or less equally, one area won't be overloaded than the other and it lasts for longer. So alignment is important. So that's why I get certain x-rays done before the operation to make sure that alignments are perfect. Once alignments are good, then chances of it lasting are more. Then the quality of the implants that are put in, they should be the best quality, always used so that there's no chance of any failure. So that the cementing etc. has to be done perfectly, and of course the expertise of the surgeon. Some specialist like me is best to do these operations rather than a random general specialist. Apart from that, of course, time, all right, the way you use your knee. So people use it in different manners. So when you ask me what can you can do everything, but I always give them the example. So if you're from India, I give them the example of a Maruti Suzuki car. So this was one of the first privatized cars that came into the market in the late 70s, early 80s. you still see those cars. And one of our legends, couple, they've launched it. You still see them going on the roads. Daewoo came, Chevrolet came, Ford came. You hardly see any. Why? Because the quality was good, number one. Apart from that, people, having a car was a big thing in the 70s and 80s. You'd maintain them, service them regularly, and hence you still see them. But in the 2000s, money came in. So cars were for 4-5 years, then you change it. So they would end up going into the dumps after they use. So maintenance, how do you maintain it well? Avoid impact activities. Jumping, running, skipping are avoidable. Sitting cross-legged on the floor, though you can do it, should be avoided because a lot of pressure goes when you get up. So these are the things you can do to maintain it for it to last as long as possible. So what does current literature tell us? So current literature tells us, if you compare apples to oranges, because world over, not only specialists do these operations, non-specialists also. So let's say a goldsmith makes wonderful statues with gold. That doesn't mean he's going to make it with copper, but he can do it with copper. Also, better than a common man. Same way. So if you're comparing a goldsmith to a coppersmith to whatever, and all of them are working with gold, then there will be a difference. So going by that average, comparing apples to oranges, they last about 10 to 15 years. However, that doesn't mean they last 10 to 15 years. They can last even 40 years when done in the right hand. And they can go in even 5 years if not done properly. So important is 4 things to a successful surgery. Who does it? It should be a specialist. What you put inside should be the best quality. Everything used should be disposable to minimize the chances of infection. And 4 is God. 3 things are in your hand. Do not do injustice to them and you will be fine. I hope you got a lot of information about how long joint replacements last. What should you do to make them last longer? If you like my video, please like and subscribe to my channel. Please follow me on Instagram. For those who like Hindi content, we have a very popular silver button Hindi channel. Please like, subscribe and follow it. And if you want to get in touch, there's a number below. Please contact and they can fix an appointment with me. Thank you.